that this is something to share with the outside world. This is about you, and this is about inside the hospital. But the reason we are recording this session is we just thought it would be helpful should other staff who aren't able to join this session be able to see it. So we'll make sure that we do that. So I want to start by thanking you for coming today. We're really pleased to have representatives of our hospital, both here in the UK. We had colleagues from the UAE on this morning, which was wonderful. And I'm not sure whether anyone from the UAE is on at the moment. It will probably be about 7 o'clock in the evening. So I hope they're stuck in the traffic jam driving home, which is what you tend to do at this time in Dubai or Abu Dhabi. But it was great to have them here. It's also really wonderful, and I can see Angela there from our colleagues at the Friends, but also colleagues from Moorfields Eye Charity, because this is about one big family, and we've been like that throughout the period of this pandemic, and that's how we operate as a hospital. So it's so nice to have all of you here. So this is about, as Tessa described, reflection and also about reconnection. And I just want to talk a little bit about what we're trying to do to help bring people together, to welcome people and to think back. The first thing this week is that all of my management executive colleagues, so that's all the directors that sit up and down this corridor, many of whom you will know, people like John Spencer, Jonathan Wilson, Joe Moss, Sandy Druitt, they're all going to be out and about this week across our whole network. So I'm looking forward to joining colleagues in Ealing on Thursday and Croydon on Friday. But I know, looking at the list, Louisa, Tracy, all of our team will be out and about in the network, having similar conversations with you and your colleagues. So I hope you can use that opportunity to talk to them. So in terms of recognition, one of the first things we set up was what's known as a rainbow wall. And for those of you at City Road, if you go to the Health and Wellbeing Hub in Kemp House, as I did this morning, there is an opportunity there to leave a message that you want to recognise your colleagues, members of this hospital who have done amazing things. I think it's a really important thing to do. Reading a lot of the messages this morning was very moving. We want to save that wall. We kind of would quite like to sort of cover it up and keep it for 50 years, because we'll be looking back on this terrible time and quite fondly how we responded. And so we're going to use that wall as a way of remembering. So if you're here at City Road and you want to go and write on that wall, please do. We would welcome people to do it. We have a similar one set up in Bedford and a similar one set up in Croydon. So opportunities. And if for any reason you can't get to one of those three sites, then if you email the team here, so either our comms team or Denise, or you can email me if you wish, we will make sure we cut and paste your comments, and we'll do a sticker for you so that things can be reflected. So that's about recognition. I think also in terms of reflection, Tessa mentioned that on Friday we're very lucky at 1 o'clock that we're going to have a virtual spiritual service and celebration. It's a multi-faith event led by Reverend Tola Badijo. So it is, if you are particularly religious or if you are spiritual and you'd like to join it, we would love to have you. If you have no religious leaning or faith but you'd like to see what's going on and be part of it, please join. This is a very inclusive opportunity for people to look back at all the difficult things of the past 15 months, but also some of the positive things, and to give thanks as well as remember those who will always be in our thoughts. The other area of recognition is our photo gallery, which will be launched tomorrow with Moorfields News. Looking at the screen today, I know a number of you have been photographed and will form part of that gallery. And that, again, is a snapshot of remembrance of all of you, which will stay within our history for many, many decades to come. So, you know, however old you were when you had that photo taken will stay forever, which is quite pleasing as my hair starts to disappear at a rapid rate. But it's a really nice opportunity to remember Moorfield staff, our charity partners, and everybody who gave so much. And if you're not in those photos, we've tried to do it in a way that colleagues are in those photos who can represent you and your department and the huge team effort that we put in place. And thank you to everybody that's taken part. Also, in terms of recognition, and you will struggle to see this even with my camera, but we have got 3,500 new pins that have just arrived, and I've pinned mine there on my lanyard. These are now available our fabulous comms team and HR colleagues and I were trying to work out a sophisticated way to make sure every member of staff got one of these, and realised that there is no such thing as a sophisticated way to do that. So we have them all available, and we are going to sporadically try and get them to everyone we find in an organised and disorganised way. But there's plenty available here along this corridor, but we'll be bringing them out to all of our sites this week. It's a small opportunity just to recognise the fantastic efforts of this hospital. And as I was saying to the team this morning, it may not seem much, but in about 30 years, when you're talking to your grandchildren, sitting down and relaxing, and people ask you, what did you do during the pandemic? What was your role in everything? You can bring something out that's just a small memento, which you should all take enormous pride in showing actually this huge effort, that whatever role you took during the pandemic, you formed a major part of it. So those are the areas we've looked this week to try and remember and to recognise. Just on remembrance, I wanted to talk a little bit about the people that we have lost during these past 15 months. And two individuals in particular, and very, very sadly. And the first is Barry Crane. And Barry was the lead porter here at Moorfields City Road and been with us since 1993. Barry sadly passed away in April last year as a result of COVID. He is much missed. And yesterday, on the occasion of his 72nd birthday, I had a great honour, and it really was a great honour, to spend time with his wife and his children and his grandchildren and his niece, and unveil the plaque to Barry in the reception area of the hospital, just to remember his life, remember all he did for this organisation and how special he was. And Declan Flanagan joined us, past medical director, yesterday. And sorry, there you go. Adiboli, if you wouldn't mind going on mute, please. Thank you. Declan Flanagan joined us yesterday, and Declan told everybody, and as you know, Declan's always very sincere about these things, that when you were a trainee at Moorfields Eye Hospital, if you wanted to know how to get patients booked into the operating theatre, Barry was the person that you spoke to, because he knew everything. And I thought that's quite a sign of the spirit of this hospital. As I said at Barry's memorial yesterday, or the unveiling of his plaque, and as I said this morning, I'm incredibly proud of this hospital in the amazing science that we deliver, the fantastic research, all of that whizzy stuff around gene therapy and the London project, the stuff that hits the front page of the newspapers. That's all really important, but what makes this hospital the great institution it is its people. It's all about people. And Barry is a shining example, was a shining example of a Moorfields person. And he will be much missed and left us, unfortunately, far too soon. And as we agree this morning, if you have religion or faith, and if you don't, please just take a moment in your own time or amongst your team to remember those which we've lost. And the second person that we sadly lost to COVID only a week after losing Barry was Paul Cablisi down in Croydon, one of our specialty doctors. A fantastic man, not just a great doctor, but a minister of his local church, and most importantly, a dad, a father, a husband, and all of those things that actually make up the majority of what's important in your life. And Paul, sadly, as I said, we lost Paul a week after Barry, after a very long and difficult period of time fighting COVID. So this Friday, I have another great honour with Nicole, Paul's wife, and Randy and the children. We'll have a church service, and then we have an opportunity to unveil a plaque to Paul down at Croydon, which was his home and meant so much to him. So those are incredibly difficult things to go through, but I wanted to just let you know that as an organisation, we are remembering those two individuals, and as Barry's family said to me, just over a year after the event, it really felt like they could start to think positively and move forward and remember Barry for everything that was so special about him in this organisation. And I'm sure the same will be Paul of this week. So that's it, again, in terms of remembrance. In terms of support to you all, and this may or may not be relevant to you as individuals, but please do keep an eye out for your colleagues. I just want to remind everybody that we have in place a big support network for people that have struggled over the last 15 months or are struggling now. And it may be that you've lost a member of your family to this terrible illness, and I know that has happened to a number of colleagues, some of whom are joining these calls today. It may be that it's made you anxious or scared or frightened. It may be, as Tessa said, that you haven't, for whatever reason, really been able to leave your house or your flat or your bedroom during this period because you've been shielding or you've been looking after yourself and you're worried about coming back. All of these things are completely natural. So we've put in place with a company, Validium, full 24-hour, 7-day-a-week support, and they will signpost and support you if you need that support. Our fabulous HR team is also here. I am here. We are all accessible. So please, it may not feel relevant to you today. It may feel relevant tomorrow, but could you please pass that word on to all of your colleagues, particularly those who you may think are starting to struggle. So I just want to move on a little bit to giving thanks to people. And I hope I don't miss people out, but I thought this rather long list was important because sometimes we forget what we've all been through in the past year and a half and some of the amazing things that you and your colleagues have done. So first and foremost, and this is not in any particular order, I want to thank those of you that were redeployed to support the broader NHS during the pandemic. I can't tell you how incredibly brave some of you and your colleagues were. Well, if you were there, you knew how brave you were, even if you didn't feel it at the time. Having gone from delivering an elective service in a relatively calm and controlled way, even though the clinics were busy and chaotic, to suddenly find yourself on a busy ITU, being with patients who are dying, not being able to see their families, all of that brave support you did, switching to night shifts when you haven't done night shifts in 20 or 30 years. People were unbelievable, and you should all take immense pride in what you and your colleagues did. As I said to people this morning, some of the bravest people I met in this hospital were people that came to me when I asked if they would be redeployed. They said yes to ITUs at the UCLH and Royal Free and other hospitals only on the condition that I didn't tell anyone they were going and I didn't discuss it further, because they were so modest in their approach. They did not want it to be about them. They just wanted to do their bit. And that's the type of people that you have working in this organisation and why we should feel very proud. So a big thank you to all of you. I want to thank the vaccination team, and I see colleagues from pharmacy here and from the broader team who have done the most amazing thing. You know, the only way out of this pandemic, or the only way of more safely managing it, is through the vaccination programme. About 87% of Moorfield staff, thank goodness, are now vaccinated. So we're making great progress. And of course, we can see in the country some age groups, you know, 98% are vaccinated. And that is why this terrible increase in infection rates, which we're seeing, is so far not turning to mass levels of hospitalisation that we saw before. It's a massive shout out to the vaccination programme and the power of vaccination. But I want to thank the team here who stood everything up incredibly quickly and very, very successfully. And if it wasn't for me getting COVID, I would have used the services myself. But unfortunately, I got it right in the middle of that vaccination rollout. So I had to go and disappear to a small hospital down the road to have my vaccine delivered. But thank you to the vaccination programme for everything that they did. The infection prevention and control team, Catherine and Amita, all the colleagues, I mean, they stood up in the face of no real science, no real data, and kept this hospital safe. We had some very, very low levels of outbreaks, and that's because of their leadership and their support. So a big thank you to the team. The pathology team, David, Margaret, many, many more, who got us tested, who got us looked after, who got our results back quickly, who made themselves accessible and experts in a field that nobody thought they would need to be in what seemed like hours. A huge thank you to them. And then to our innovative staff, all of you. I mean, let's not forget that A&E turned into a virtual service over the computer in 2 days. That's how quickly they stood up a virtual online support to look after Londoners with emergency eye care. Many of our clinics switched to remote working really successfully to give our patients support and security. We opened up a brand new diagnostic hub in Hoxton in the middle of a pandemic and recruited the staff and bought all the equipment. I mean, stuff that people would think is ridiculous. you managed to achieve. And it's great credit to you all. Many of our clinical staff rotated themselves onto the front door at City Road. And as I was saying with colleagues earlier, I went down to A&E every day. On some days it was moving smoothly, and then on some days it was a little bit slow and chunky. And when I asked some of the nurses why it felt a bit slow and chunky, they remarked that it was fabulous to have certain members of the great and good of world ophthalmology giving their time up in A&E, but they were perhaps working at a slightly slower pace to that which they did 30 years ago when they were last in A&E. But how grateful were we to have them? And those trainees that were at A&E could not believe the level of teaching when they got some of the great and the good down to look after them. So a big thank you to everyone who's not used to A&E, and that Gordon either had to convince, but he didn't have to convince many, because everyone was keen to come down and support, and a big thank you. Many of you won't spend much time in the basement here at City Road. I don't spend as much time as I should, but our stores team did the most remarkable job with colleagues at the Royal Free. At no stage during this pandemic were we ever short of PPE, which is remarkable. And I remember on a Friday night, Tracy talking about face masks when we were a bit worried we were down to about 20 or something for the whole hospital. But we begged, stole and borrowed and made sure, thanks to our stores colleagues, that we were never short. So thank you so much. Many of you won't know that our colleagues in the UAE, which is a purely private hospital, 50% of them redeployed into the government buildings to support the fight against COVID in Dubai and in Abu Dhabi. So that's a massive achievement of our colleagues over in the UAE, and just goes to show that Moorfields supporting this pandemic wasn't just a British effort, but was worldwide. Our private team here in London did the most amazing work to give up all their operating theatres, all their space, and move all of their personal resource into supporting the NHS work or being redeployed, as many of them were, and I'm very grateful for their support. I was in almost every day in the pandemic, and I wasn't alone. Many of you were with me, but also with us were all of our ISS cleaners. They were there every single day, scrubbing the floors clean, making sure we were safe whilst putting themselves at risk. So I'm going to speak separately to the Managing Director of ISS and make sure, and please do it if you see them, that our ISS cleaners get one of these pins, because boy, do they deserve it for everything that they've done for this organisation. I said to Angela on many occasions that I knew we were coming out of this incredibly difficult time when I saw lots of people in green zippies directing members of the public around this hospital. And I saw that again this morning when we were all getting slightly confused with the new one-way system, which is very effective. But obviously people needed coaching in. So I want to thank Angela, who has been a great support of mine during this period. She's kept in touch with me regularly. We had to fight to keep the volunteers out of this hospital because they wanted to be here, which just goes to show the type of values that they have. But we had to look after them, and now they're back. It is fantastic. So thank you, Angela, for your leadership and for all of your colleagues. And also to our iCharity, who have not just put into money and support for things like the Wellbeing Hub, but have provided meals and supports for things like the cataract drives and everything we've tried to do, and have really felt like our partners and colleagues, as they always have been along the journey. Who remembers the Moorfields motivators? I was saying this morning, do you remember those videos? So we had some A-listers, like Ozzy Osbourne. Can you believe Ozzy Osbourne was wishing you all well? As I said this morning, I'm not sure he quite knew what he was saying, or probably what planet he was on while he was saying it, but it was still Ozzy Osbourne as an A-list star wishing us well. And then we had a few D, maybe E or F list stars from the 70s soap operas, some of whom I knew, some of whom I didn't. But it was so nice to have people putting their time and effort, including Noddy Holder, as I just remembered, thanking you for all of your support. I want to thank my executive colleagues along this corridor who really did go the extra mile. So many of you won't know, but a number of them stood up immediately to take on big national roles, which was time consuming. It meant they were away from their families, but they did it the drop of the hat to try and support and help this country, and we should feel very grateful. And then finally, I want to thank our communications team, because one thing many of you have said to me throughout this journey is that the communications have been clear and consistent, even though it's been difficult and confused, potentially also at government level at times, because this is a difficult period. We've tried in our communication teams to condense it into clear and understandable instructions and language. And you won't know this, but we all have various WhatsApp groups, and many of them are used to me texting them at 7 o'clock on a Sunday morning, asking them to do stuff, and they've all agreed without hesitation, I'm sure they were probably cursing me outside of it, to do what was needed and support. And I just wanted to say a very big thank you to our communications team. So thank you all for joining. I know it seemed like a long list, and I haven't covered half the people, but we should all recognise how amazing this organisation has been. And the reason we rattle off a long list is it sets the tone for the future. And I'm actually in a strange position of being incredibly jealous of my successor, Martin, because he's coming to join an organisation whose future is probably one of the most exciting in the country. And that's the same for all of you. The journey really is just begun. You've proved what a fabulous team you are, and I know it's only going to become even more exciting and even more positive. And to set the tone for that, we'd like to play you a very brief video. So hopefully Sam will be able to do that, and then I'll just have a few words before we break out into sessions. Thanks, Sam.
Here's to our staff, past, present and future, whose dedication and innovation transforms the lives of patients with sight problems. From artificial intelligence to gene therapy, Moorfields Eye Hospital is a world leader in eye care treatment, research and education. Our commitment to patient care and safety sits at the heart of everything we do. And when COVID-19 threatened us all, Moorfields was ready to respond. As the scale of the pandemic unfolded, staff were redeployed across London to help care for the sickest COVID patients. Our teams came together remotely and on site to transform clinical spaces, set up diagnostic hubs, and ensure vital treatment and surgery could continue. Just 2 days after the nation was locked down, Moorfields opened its online A&E eye service. Thousands of patients received emergency eye care, all from the safety of their homes. Theatres at Moorfields Private were made available to NHS patients, with colleagues working together to treat as many people as possible. And we delivered an NHS first, carrying out more than 700 procedures in 6 days in our cataract drive. Our teams have continued vital sight-saving care, including a second cataract drive at Moorfields Croydon, which blitzed surgical waiting times caused by the pandemic. When the second wave hit us hard, more than 150 staff once again redeployed to treat COVID patients across London and Bedford.
Metron.
Dedication to patient care at Moorfields and beyond remains a priority.
Sorry, would you mind going on mute? Somebody's just joined us.
Sorry.
Thank you.
With plans for our new world-class facility in Camden. In partnership with the UCL Institute of Ophthalmology, here we will engage with and train the ophthalmic care specialists of the future. Our investment in the future of eye care is supported by contributions from our private hospitals, Moorfields Private and Moorfields UAE. From the front line to online, we are committed to providing excellent patient care, now and in the future. None of this would be possible without our amazing team of staff, volunteers and fundraisers. And so, to our friends of Moorfields, the dedicated volunteers who guide and support patients coming into our clinics. To our colleagues at Moorfields Eye Charity, who raise funds for vital eye care, research, equipment and training. Not forgetting the money raised for the new Wellbeing Hub, a much-needed space for staff to rest, relax and recharge. And to you, our patients and fundraisers, for all of your support. To Ezra, Ken and Maisie. To our staff, volunteers and our patients, thank you to each and every one of you. sending you all love from Moorfields.
Thank you, Moorfield.
So I hope that made you feel as proud as it made me feel, and thanks to everyone that was involved in pulling that video together. That's now available on social media and will be out and about as an opportunity just to celebrate everything that we're proud of in this hospital. Many things from that video sort of come back to life. I remember walking many days from London Bridge to Old Street and not seeing a single person, but remembering when you got through the four walls of this building that you felt like you were safe, you were home, and you knew where you were and you were supported. And that's really, again, another testament to all of you and the fantastic work and support that you put into this hospital. So that's it by way of me and the video at this session. And now there's a really good opportunity away from people like me for you to actually sit and reflect with a small group of colleagues, all of which won't be attributable to anybody, but if there is particular themes, it's really useful for us to understand those so we can think about how we plan our support services going forward. Can I just leave by saying that this really is an important week, and to reach out to your colleagues to think about remembering, recognising and reconnecting. I think it will be a great opportunity for all of us as we move forward into the future. So thank you all very much, and I'll hand over to Denise now.